A classical way to look at the effects of alcohol, clinical effects, with respect to the blood level, are always pointed out by charts like this. And here we are going up from a very low level, about 1/4 legal intoxication level in terms of milligrams per DL, all the way up to, 20 times as much. So let's just say there's a sliding scale between very slightly or threshold effects of alcohol versus the lethal effects, acute lethal effects. At approximately the level of 20 milligrams per DL, or what the police meter would probably call 0.2%, 0.02%, the first clinically noticed effect, a threshold effect, is a slight decrease in inhibitions and, subjectively, a mild feeling of intoxication. At the legally intoxicated level, 80 milligrams per DL, or 0.08%, you have a decrease in complex cognitive functions and motor performance, and this is the level at which, statistically, you have a tremendously more likely probability of being in a car accident. You double that, and now it doesn't take a rocket scientist to know you're drunk. You have slurred speech, motor incoordinations, a lot of things I get when I'm giving these lectures as well. Irritability, very, very poor judgment. Now you're up to about 300, and you're in very serious trouble. We're talking about coma, usually reversible, but I think most people would tell you that the lethal level of blood alcohol in terms of milligrams per DL or deciliter is about 400. You have a serum blood alcohol level of 400 mg per DL, there's a good chance you're dead. Let's look at its metabolism. Here we have, there's metabolisms at 3 different levels in the cell. There's at the microsomal level, the cytosol level, and the peroxisomes. At the microsomal level, which is not the majority of the metabolism, the majority is at the cytosol level, we have NADPH going into NADP plus and metabolizing alcohol into acetaldehyde. The same is being done at the cytosol level for most of your alcohol, 80% of it. You have ethanol being converted into acetaldehyde, and in the process of this oxidation, NAD plus is giving off an NAD plus a proton or a hydrogen ion. The acetaldehyde can be further oxidized in the mitochondria into acetic acid, also splitting off NAD into NADH plus a proton. So here we are, as this is being oxidized, this is being reduced. And also at the peroxisome level through the catalase, we also have the conversion of hydrogen peroxide into regular old water. So this is the chemical metabolism of alcohol. You'll see these little charts very often talking about what your estimated body weight would be versus your blood alcohol level and how many drinks. And I encourage you to, just take a look at some of these. It basically tells you how many drinks you could have before you're legally drunk, before you have some impairments, depending on your body weight. Knowing that if you weigh 200 pounds, you need twice as much alcohol to produce an effect than 100 pounds. And of course, all of these colored levels are in the legally intoxicated levels. When you get to about 0.8% or 80 milligrams per DL, you're talking about legal intoxication. I think some states have a little bit higher than that. Most states are 0.08. So I want you to remember that. I want you to remember, and because the terminology and the units are always confusing, because the blood alcohol meter will be expressed as just a regular old percent. So if that blood alcohol meter is higher than 0.08%, you're going to jail. if that would be translated directly into 80 milligrams per dl, which are the levels we use mostly in laboratories. I love to throw in these Windmark equations because they scare you at first, but all they do is show you a couple of things. Is that your concentration of alcohol in your blood is, number one, directly dependent on the mass of alcohol you ingested, and it's inversely proportional to your body weight times a constant, and the constant is a little bit different for males to females because there's a little bit of a difference in the way men and women metabolize alcohol. But a question which is often asked is, how long do you have to wait for your alcohol levels to go down? And I'm going to try to give you an overall estimate. You drop your level of alcohol about 0.15% per hour. So if your legally intoxicated level is, let's say, 5 times as much, and it took you 5 or 6 or 7 drinks to be legally intoxicated, every hour that you wait, you're going to be dropping a drink. So let's just use the general principle as 1 drink per hour. And that's the easiest way to remember it. Let's talk about some of the really, really bad things, classically bad effects on the body that alcohol has, especially the liver. Let's talk about a spectrum of changes going from the presence of increased fat in the liver, called fatty change, or fatty metamorphosis, or steatosis, or hepatic steatosis. Goes by a wide variety of names, all the way progressing to alcoholic cirrhosis. And remember, this is not something that has to progress. The general rule is if somewhere along this spectrum alcohol is withdrawn, it will not progress from fatty change to alcohol hepatitis to alcoholic cirrhosis. Of course, once you get to alcoholic cirrhosis, by definition, cirrhosis is an irreversible diagnosis. So let's talk about mechanisms by which alcohol produces increased fat. There's a whole wide variety of them. And then we'll talk about the inflammatory changes, generally called alcohol hepatitis, which many can progress into downright alcoholic cirrhosis. So in fatty change, we have increased fat in over 90% of binge drinkers as well as chronic drinkers. Of course, fat is also increased in the liver with diabetes and obesity, but alcohol is one of the other 3 big common causes. Because the fat is increased, the liver is generally enlarged. The patient is usually asymptomatic. There may be minimal or zero increase in enzyme changes as well. And this, when the globules of fat become larger than the liver cells themselves, that's called macrosteatosis. If it doesn't have inflammation, it's just fatty change, even if there's a tremendous amount of liver, even if a half or 2/3 of your liver is fat. If there's no inflammation or necrosis, that's just fatty change. Once you have inflammatory changes, this is alcoholic hepatitis. Only about 10% of alcoholics that have fat in the liver will develop alcoholic hepatitis. Now you have significant enzyme elevations rather than mild or none. Now you have jaundice perhaps. Now you have necrosis. You'll have little substances which we'll see called Mallory bodies. And a good number of these may progress to cirrhosis. And cirrhosis has its own specific definition and appearance, and we'll talk about that as well. So let's get into it in the next clip. Thank you very much.